Onc Live Insights is a video editorial program produced by Onc Live. Onc Live Insights features in-depth reports, feature segments, and profiles of leaders in clinical medicine, providing expert perspectives in cancer care and emerging research.
When we are looking at, we have two different groups of patients we've already discussed. We have the HPV population and the HPV negative population. Let's talk about HPV positive disease.
What I think as a cancer immunologist, immunotherapist myself, is that we should not think of cetuximab itself as an EGFR inhibitor. We should think of it as a monoclonal antibody, has the capacity not only to block EGFR on the tumor, but to stimulate the immune system to recognize the cancer.
There are also data that patients with a so-called inflammatory phenotype, and these are tests done mostly in blood, but also in tumor, measuring inflammatory cytokines. They may be patients that may also not benefit from an EGFR inhibitor.
Hello, I'm Joe Petrozello, Head of Clinical Affairs with OncLive.com. We recently sat down with some of the world's leading experts to gain their insights on the latest clinical advances in cancer care. In this OncLive Insights video editorial series, we reviewed the latest clinical advances in HPV positive head and neck cancer. Hi, Dr. Murphy. Thank you for joining me today for this OncLive Insights video editorial program on the treatment of head and neck cancer.
It's my pleasure.
So let's start by talking about the evolving treatment landscape in head and neck cancer, recent advances, sort of where you've been and where we're headed.
Good question. I think it's really important to recognize that head and neck cancer has changed dramatically over the last 10 years. 20 years ago, 30 years ago, when we thought about head and neck cancer, we thought about tumors that were associated with smoking and drinking. Now we recognize that head and neck cancers are not only associated with smoking and drinking, but can be associated with viruses, particularly Epstein-Barr virus and human papillomavirus. What's really important for clinicians to recognize is that there is an epidemic of human papillomavirus, or HPV virus, in the U.S. community. Because of that, we are seeing HPV-associated cancers. One of the HPV-associated cancers that has increased in incidence is HPV-associated oropharyngeal cancer. We didn't even know about this entity 10 and 15 years ago. So the fact that we now have HPV-associated oropharyngeal carcinoma as a major cause of head and neck cancer is a dramatic shift from 20 years ago.
Since 2006, we've had the advantage of the first targeted agent for head and neck cancer to be FDA approved in 4 decades. That's cetuximab, and positive data both in the locally advanced setting, combining cetuximab with radiotherapy. The so-called Bonner trial was completed in 2006. That has become a relatively commonly used standard of care for locally advanced head and neck cancer. Likewise, in the recurrent metastatic setting, the first-line recurrent metastatic regimen based on the EXTREME regimen, which was the name of the clinical trial, which combined cetuximab with platinum 5-FU in a randomized phase 3 design showing an overall survival benefit. And so the landscape has incorporated targeted therapies against the epidermal growth factor receptor using a therapeutic monoclonal antibody that's become really the one of the standards of care used frequently in head and neck cancer.
We have to realize a few things about squamous cell carcinoma of the head and neck, and evolving really is the perfect word to capture the atmosphere. What we've begun to realize a little bit more than a decade ago is that human papillomavirus plays an important role in the genesis of many of these tumors, and that HPV positive head and neck cancer occurs primarily in the oropharynx. It occurs often in non-smokers, non-drinkers, and often in patients who are younger. And it really has changed the landscape of the disease remarkably. In fact, HPV positive oropharynx cancer is one of the fastest growing cancers in terms of incidence in the United States. Contrast that to HPV negative disease, which is really the more traditional tobacco-associated cancer that many of us have come to stereotypically identify with squamous cell carcinoma of the head and neck. These are cancers that occur in all sites: oral cavity, oral pharynx, hypopharynx, larynx. As I said, often associated, if not exclusively associated, with tobacco use, especially cigarettes. And while the US population and in other countries have clearly gotten the message that smoking is not good for you, and have now begun to decrease smoking rates, we're actually seeing a decrease in HPV negative cancer in the United States, in contrast to the increase in incidence that we're seeing for HPV positive cancer.